White Knight, medical esthetician here at Allure Medical Spa. In this video, you will learn how to do the procedure called Miradry. So the first thing that you're going to perform is you're going to take alcohol and clean the underarm area, making sure that it's free of any lotions or deodorants. Once you're done wiping the area, you will then start to do your measuring to figure out what template you'll be using on your patient. When performing measurements, you want to connect the dot on the top area where the hair grows, as well as the bottom portion to make sure that you're getting the full area where the patient can sweat. When you're putting your dots, you want to look at your width to see how much in the width area the hair is growing so that we can have the correct template. What was your template?
It looks like 60, 140 and 60.
So on this patient we're doing 140 by 60. Once you're done putting your dots, you will then grab some more alcohol on a gauze. Make sure it's kind of damp. I keep my alcohol in a bowl so that way it's not double dipping. It's the same patient and the same alcohol. So just kind of wipe the area and just kind of make sure it's kind of damp as you do it. When you leave some alcohol on the skin, your template will gravitate better. This is what your template will look like. You want to make sure that the person on the bottom is always facing in the same direction as the patient on the bed, and then it will go upside down like such. There are dots in the paper that will match your dots on your template that you're placing on the skin. The reason the skin is damp is so that as you're sticking it on there, it will smooth out, and then you'll go over it with damp gauze again. This is kind of like one of those temporary tattoos, so you want it to come off on the patient's skin, so that way you have your markings for all of your injections that you'll be performing. Once you do that, I always kind of like to just touch it, make sure everything is nice and smooth, and then as you start to lift off, you want to make sure that it's sticking to the skin. Now I always let patients know that this does wash off at the end, that they don't have a grid mark in their armpit for when they leave. And then we'll start our injections. We do 2 rounds of this. The first round we're going to do our X's. The reason we do that is when we go back to do the dots, the patient will already be partially numb and they won't feel all of the shots. So you will do a half cc in each area that you inject. Ready?
A little closer.
You want to make sure you're injecting on an angle, not going directly into the skin. It's almost like you're stabbing them if you don't go on an angle. Make sure you know how to track where you've injected. I typically, if I'm grabbing a new syringe, I will place my finger just on the spot that I just injected, so that way I know where I'm continuing. The sensitive areas are the center of the armpit to the edge for most patients when being injected, or if they start to feel it during treatment. It's always a possibility. So we always like to have extra numbing on hand in case they do feel it.
Oh, yeah.
And always ask your patient how they're doing. Now that we completed our X's, we're going to start with the dots. And she's already partially blocked, so she shouldn't feel many of these pokes.
Did you really feel those lines?
No.
So our patient's comfortable, she's not feeling all these that much, which is good. So it makes it a little bit easier to tolerate getting so many injections. So now we're going to load the Miradry machine up. So what you do is you're going to select your arrow. It's then going to say to load your tip. So when you're loading your tip,
The whole thing goes up.
you're going to grab your tip and you're going to make sure that the bottom portion of the container is like this on your tip here. So you're going to push it in, you'll hear a suction, and it will give you a go. If it doesn't grab like it just did in me, it will tell you that, and you will do it again. And now it's loaded. So now that you have a green arrow that your tip is loaded, you're going to hit the arrow. Now you have to select the template that's on your patient. So we did a 140 over a 60. This is treatment number 1. Also, you want to hit this little mechanism here, and there is a lock button, and we want to unlock it because we want to make sure she gets the full level throughout the entire treatment area. Just reminds you of your injections, and we're going to do a level 5, which is the highest. And then it's going to load up your template, and it's going to remind you that that's the template you selected to start with. And now we're going to start treatment. So now that she's nice and numb, you can actually see the area is kind of white just because it shows you where some Lido with epi has been placed. So now we're going to go ahead and place on our lubricant. You can use either gel, ultrasound gel, Steri-Lube. It's a personal preference. So you want to place it over the entire area. Now that you're going to start your treatment, you'll go ahead and grab your tip. Now there are markings that are little dashes throughout the entire template. There's a dash that's located on your tip. Your tip has to line up with the dash on the arm, and then you want to use good pressure so that when you start the treatment, the suction will grab it. The first 6 seconds it does a cooling, then it goes to your heat, and then it'll cool again. So you can see the loading on the bottom of the screen. Once it goes cooling, it will count down to 20 seconds of cooling, and then it'll complete your pulse. You always want to start from the top, working downward. So now we're going to go to line 2. And again, we're going to start at the top and work our way down. Now we're going to keep going on. We have 15 lines to complete. Once we get done with this arm, I will show you what it looks like after the pulses have been completed before we clean it and move on. Now we're going to complete our last pulse here. So as the patient's getting her treatment completed on this side, once the pulse is complete, we're going to clean up her underarm area, removing all of the markings from the template as well as the gel. And then what we're going to do is put an ice pack in her arm so that she can ice while we're treating the second arm. So now we're just coming to the end of this pulse. Now we're going to go ahead and place our tip in its cradle. Get some alcohol on a gauze. Now the patient's still numb, so she still won't feel it, but it'll feel like funny pressure. And we're going to clean the area. Now the round marks, they kind of look like hickey marks. It's from the suction on the machine. Generally, it goes away within a couple days. Now the patient can't feel this, so you can rub a little vigorous if you need to stretch the skin. You can remove all of it, and that way all you see are the little suction marks that are left in your 2 original dots. Now that she's done cleaning the area, she's going to go ahead and get a nice pack and tuck it in. The patient's numb, so they can't feel where the direction of the ice is going, so you'll have to guide them. Their shoulder will be sore, so it's kind of nice to just give them a moment before you start the other arm. So now we're going to start performing the treatment on the other arm. You're going to do the exact same steps that you did in the beginning. She's already wiped the skin, so now she's just going to double check her template and mark the area for placement. So you're going to perform the exact same steps that you did on the first arm to complete the treatment on the second arm. Once you're done completing this, you'll actually give the patient ice to go and make sure that they're aware of all their aftercare and the treatment, what to expect, and make sure that they can get a hold of you and call the company if they have any questions in regards to their healing process. Then you also want to make sure that they're scheduled for their follow-up visit, and then if another treatment's needed, schedule that as well. So I hope you've enjoyed watching how to perform a Miradry treatment. If you have any questions, always feel free to ask one of the technicians as well as a provider. If you have any questions in regards to aftercare or comments that patients might go through that you need help with, always feel free to pull one of us. But thank you for watching. Again, if you have questions, please let us know.